health centers in Alameda County have always been committed to the mission of providing health care for communities who were otherwise underserved either because they were uninsured, they're immigrants, they don't speak English, they have other barriers to receiving care in the rest of the healthcare system, and that's been the mission since the day our health centers started, mostly in the 1970s.
We did what we did because there were people then that we could identify were excluded systematically, and something had to be done about that.
I was driven to join in this movement because I viewed it as a very integral step in bringing more communities into having health care as a right.
This was at the time that the clinics were forming, and the clinics all reflected the communities that they came out of.
And in the mid-1970s, the health centers got together with this notion that by working together, that would sort of give them another tool in their toolbox to advance their individual missions of improving access to health care. So the Alameda Health Consortium was born out of that notion, that idea, that aspiration that there was some greater strength in the power of working together across the communities, across the geography, across the populations that the health centers served.
We all wanted to work together because coalition was really important. We didn't want to work against each other. And we made an agreement very early along between the leaderships of each other. And in some cases, we helped groom each other's leaderships. People that come in off the street that wanted to do something, and they become leaders. So we weren't there to work against each other, we were there to work with each other.
We have an incredibly dedicated staff, from we have people who've been working at our health centers for 35 years.
When I arrived, there were 5 employees. There was Ralph Silber, there was Dorothy Graham, there was Ross Taub, and there was Christopher Martinez, and then it was myself. What I also remember is that Dorothy had a computer in her office, Ralph had a computer in his office, and Ross had a computer in his office, and the rest of us had to share one IBM computer amongst ourselves. So we actually had to take turns in using the computer.
This organization was so lucky in having a committed board of directors who had a passion for making a difference and making a change, and to working on policy that would make a difference in the long run.
CHCN started in the mid-90s because the state of California made a decision that in urban counties like Alameda County, they were going to start forcing, is sort of a hard word, but the word they use is mandatory. For certain people who had Medi-Cal, they were going to have to get their care through one of 2 HMOs. With our executive directors, we went through a very deliberate process, like 2 or 3 years, of essentially trying to look at how could we best organize ourselves to succeed under Medi-Cal managed care and essentially be able to continue taking care of our patients. Pat Aguilera, who was then our CFO and COO, came in my office and said, Ralph, we can do this not only just as well as these other folks, we can actually do this better. And then a couple of other folks really stepped forward. The California Healthcare Foundation wrote us a check for whatever it was, some amount of money that in those days was a significant amount of money, basically saying, we think maybe you guys can pull this off. Here's a check to cover your startup costs. And Jerry Coyle, who was then at NAM, was sort of our guardian angel. And he basically said, we'll give you everything you need to start. And he gave us a computer system and policies and procedures and lent us his staff, and we put it together.
We handed off the tools, but Ralph and the people there took advantage of them and built what is here today. So I take only credit for having been involved in the foundations.
I started here in 1998. I was actually the very first full-time employee on payroll. My very first day of work, I was handed a box of presentation material, said, "Come with me. We're going to Tri-City. We're going to explain managed care to them." So that was my very first day of work.
I feel really proud and clear to say that 40 years later, that basic idea is still the center of the work that we do, both as the consortium and the network, is to create the space, sort of literally and figuratively and organizationally and financially, for our 8 health centers to do work together that enhances their ability to achieve each of the missions they have to serve their particular communities.
One of the benefits we bring to our network clinic members is the ability to come together with like skill sets, like functions of the clinics, and learn from one another. I think that over the years, we've developed the ability for people to feel like that's a safe space, that they can share their challenges, they can share best practices with one another. I think that we're here to celebrate what to many is really a surprising result. I think we started CHCN as kind of a defensive move to figure out managed care and ensure that the clinics didn't lose their ability to see patients. And we've ended up with this amazing organization that's grown beyond our wildest dreams. I think just the wild and surprising success that we've had is worthy of a great celebration.
20 years after starting the consortium, the health center CEO sort of faced the same question, which is like, all this stuff is happening, what do we want to do? And after 2 or 3 years of studying models around the country and talking to consultants and lots of planning, they sort of came to the same decision they had when they started the consortium, which is, we're not exactly sure what to do, we're not exactly sure how to organize ourselves, but we're pretty confident that doing it together is going to be better than doing it separately.